Here at Newport Mesa Unified School District, we are very fortunate to have such a rich medical benefit plan, Anthem Blue Cross POS. This plan allows us choices at every injury, illness, or disease. The choices we make impact our out-of-pocket cost and, in the long run, the cost of our plan. Through this presentation, we hope to provide you with more information upon which to make the best choices for you and your family. POS stands for Point of Service. It is one plan that includes 3 tiers. All tiers are available to you. However, as you move from HMO to PPO to non-PPO, your cost increases. This shows you a quick reference of all 3 tiers. The items in red are the changes to our plan effective October 1st, 2013. When using the HMO Tier 1, you pay the copay directly to the provider, and then the billing goes through your medical group. For PPO Tier 2, you again pay the copay to your provider, and the provider bills Anthem. Anthem will send you an explanation of benefits, which you compare to the provider's bill to determine your responsibility payable to the provider. If you access the non-PPO Tier 3 services, payment may be required upfront. You send a copy of the bill along with the claim form to Anthem. Let's review each tier individually. Tier 1 is HMO and is the most cost-effective use of the plan. The HMO tier is managed care, and all enrolled employees have access through their primary care physician and medical group. Many preventative services require no copay. Remember, preventative exams are for screening to help prevent illness. Examining and treating symptoms is diagnostic care, and services are covered with a $20 copay. If your primary care physician refers you to a specialist, you are still in the HMO tier with a $20 copay. Note there is a $250 copay for the emergency room and a $250 hospital admission. In order to get the most cost-effective use of your Tier 2 PPO, always confirm if the doctors and facilities are contracted with Anthem. Do not use the word take. Some providers take our plan but may not be contracted. Basic preventative care is covered at 100%. When self-referring to a specialist under your PPO tier for injury or illness, you have a $45 copay for regular office visits. There is also a $250 annual deductible for any procedural bills. After the deductible is satisfied, Anthem picks up 80% and you pay 20%. The same $250 emergency room and hospital admission copays apply to the PPO. Non-PPO or out-of-network means that they are not contracted with Anthem. Although preventative care is covered under this tier, Anthem will pay only 60% of the maximum amount allowed. For other services, you need a $400 annual deductible before any other claims are paid. Anthem then pays 60% of the maximum allowed amount, which means the contracted rate. For example, if the contracted rate is $1,000 and the out-of-network provider is charging $2,000, Anthem is paying only 60% of the $1,000 and you pay the remaining balance of the bill. When in doubt, confirm with Anthem if the doctor is contracted. Also review with the non-contracted doctor and Anthem on what out-of-pocket expenses to expect. Whether PPO or non-PPO, pre-service review is required for non-emergency admissions, surgeries, advanced imaging, etc. It is your responsibility to make sure your doctor initiates that review before scheduling. The toll-free number for the pre-service review is printed on the back of your card. Let's review the pharmacy plan. It is a 3-tiered plan offering many prescription alternatives. Of course, the most cost-saving tier is generic medication, where you pay a $5 copay at the retail pharmacy, $35 for brand name, and $50 for non-formulary. Non-formulary medications may be newer to the market and may not have a generic available. You can save additional money by signing up for the mail order service. You will receive a 90-day supply delivered to your home for 1 month's copay. You can see by the example here that it equates to $1.67 per month for a generic prescription through the mail order. So if you take any maintenance medications, you need to sign up for this cost-effective service. Also at the pharmacy, ask for the retail price of a prescription. If it is lower than your copay, you do not need to use your insurance plan. Many retailers offer a 30-day supplies of generic medications for $4 or 90-day supplies for $10. Show your insurance card to see if you are eligible for the retail $4 generic. Take a good look at your Anthem card. Notice the medical group and primary care physician in which you are enrolled are showing on your card along with their phone numbers. You can change your doctor or group at any time by calling Anthem Member Services located on the back of your card. If called by mid-month, Anthem can make the change effective the first of the following month. Take note of the copays on your card. The copay listed for a specialist is an HMO specialist. If your primary care doctor refers you to a specialist, your copay is $20. If you self-refer to a PPO specialist, you pay $45, have a $250 deductible, and pay 20% of all procedural bills. Remember, if you use the out-of-network providers, you are responsible for the $400 deductible and higher out-of-pocket expenses. When you or your family member is sick or injured, you need to decide where to go for care. The choice you make can save you time and money. Sometimes an urgent care center is a great alternative if your doctor is not available. Urgent care centers treat patients with conditions that need immediate attention but are not life-threatening. To use your HMO benefit, contact your primary care doctor. Even after hours, your doctor or designated on-call doctor is available. They may be able to manage your urgent care situation by phone. However, when a face-to-face evaluation is required, your doctor can refer you to an HMO facility. Whether HMO or PPO, always call the urgent care before you go to verify if they are contracted with Anthem, what their hours are, and that they are equipped to handle your situation. The next time you see your doctor, ask how to handle these situations and where you should go. Also, do your homework and find out where there are PPO urgent care centers near your home or workplace. Please keep the 24/7 nurse line in mind. You can speak to a registered nurse 24 hours a day, 7 days a week. They are trained to help you make informed decisions. Can it wait until your doctor's regular office hours? Is urgent care a good option? Should you call your doctor now? Do you need to go to the emergency room? The 24/7 nurse line is there to help. They will even help you locate an urgent care center. Your benefits management department has a web page that includes plan information, links to Anthem, Cigna, VSP websites, tips for saving money, forms, resources, and frequently asked questions. From the benefits page, you can link directly to the microsite Anthem has set up just for us. You can click on NMUSD benefits to access both our plan summary grid and the evidence of coverage. You can access health information and resources and special offers. Register your username and password to log on and review your personal information. Once logged on to Anthem, you can search for doctors or facilities by clicking Find a Doctor, change your primary care doctor, request an ID card, check your claim status, request a refill on your mail order prescription. When you click Find a Doctor, you will be given options to indicate what you are looking for, including the specialty and location. Then click Search. You can then review the results. Click on the doctor's name and see more detailed information on their hospital affiliation, medical group, and more. If you are searching for a new primary care doctor, you can then make the change online through this site or call member services. The number is on the back of your card. We hope this review of your Anthem POS health plan will help you make informed decisions in seeking the best and most cost-effective care for you and your family. Thank you.